I'm Dr. Mihee from Kyungpook National University. Today, I'll present a multicenter study on AI-assisted soft tissue landmark identification using a cascade CNN model across 4 different time points in patients who underwent Tuja orthognathic surgery. Orthognathic treatment requires a serial cephalometric analysis across multiple time points. Manual landmarking is labor-intensive and subject to inter- and intra-observer variability, and most AI-based studies have been limited to the initial cephalograms and hard tissue landmarks. Therefore, we evaluated how CNN-based AI landmark accuracy changes across 4 time points in class 3 patients undergoing Tuja surgery. The overall mean error was 1.17 millimeter with no significant time point differences. Some landmarks showed post-surgical variation, but genioplasty did not significantly affect accuracy. Soft tissue landmark identification poses greater challenges due to post-surgical changes, image artifacts, and equipment variability. Previous soft tissue landmark identification studies were limited to early treatment stages and few soft tissue points, often mixing soft and hard tissue data without assessing surgical effects like genioplasty. Our study addresses this gap by analyzing soft tissue landmarks across 4 time points. We aimed to assess the feasibility and accuracy of a cascade CNN in identifying 13 soft tissue landmarks across 4 treatment stages in class 3 patients who underwent Tuja orthognathic surgery. We analyzed 3,228 lateral cephalograms from 807 class 3 patients collected across 10 institutions. All procedures were approved by the institutional review boards of the participating centers. We employed a cascade CNN architecture combining RetinaNet for region of interest detection and UNet for detailed landmark localization. A total of 13 soft tissue landmarks were manually annotated and verified by experts. Figure 2 illustrates the location of the 13 soft tissue landmarks, and Table 2 outlines their definitions. We classified error under 1.5 millimeter as accurate and analyzed their frequency. The X to Y error ratio showed if the model had directional bias. We also checked if genioplasty affected the synthesis landmark accuracy. The overall error was 1.5 millimeter with 64.9% accuracy. Vertical errors were more common, highlighting challenges in vertical landmark detection. Other facial landmarks, such as glabella and soft tissue lesion, had greater vertical errors. Landmarks such as subnasal, soft tissue A, and upper lip showed high accuracy. The STMS showed increased error at the presurgical stage due to orthodontic decompensation. Vertical errors were prominent in the lower lip, soft tissue B, and pogonial landmarks. Genioplasty showed minimal impact, suggesting AI performance remains stable across surgical variables. This study's strengths include a large multicenter dataset, 4-stage evaluation, and novel analysis of XY errors and genioplasty effects. However, vertical accuracy remains a challenge, especially for soft-to-contour landmarks. Also, our 2D data limits spatial assessment. Future studies should use larger samples, 3D cone-beam CT, and varied surgical protocols to enhance AI robustness. As a conclusion, the CNN model demonstrated robust performance even in post-surgical cases, suggesting its potential as a supportive tool for soft tissue landmark identification, despite surgical artifacts and anatomical changes. Thank you for your kind attention. You can find this article in the Korean Journal of Orthodontics 2025 issue.